This is Focus with Jack Cottle.
Thanks for joining us this evening for this month's edition of Focus. I'm Alicia Garcia, in for Jack Cottle. Tonight we'll be discussing the Medicaid expansion and what you need to know as South Dakota gears up to add more people who will qualify for Medicaid coverage. Before we start, let's take a quick look at how we got here. So much relief. That's how one South Dakotan described voters' decision to expand Medicaid in November 2022. It's been a long journey in South Dakota to get Medicaid expanded, which allows more people access to health insurance. In 2014, under the Affordable Care Act, states could increase the number of people who qualified for Medicaid, and the federal government would help cover nearly all of the cost, 90%. 26 states opted to expand, but South Dakota did not. Over the years, a dozen more states expanded Medicaid. Some did it through the legislature, some did it by voter initiatives or constitutional amendments. But when the executive branch, in other words the governors, opposed the expansion, several states were slow to implement it or had to have the issue resolved through the court system. After the South Dakota legislature failed to enact Medicaid expansion, a constitutional amendment made it onto the South Dakota ballot in November 2022. 56% of the voters approved it. South Dakota Governor Kristi Noem made no secret that she opposed the expansion. However, she did say that if voters approved, she would implement it.
Well, once again, looking at this measure, it appears to be written constitutionally. So if the people pass it, it'll be implemented.
And that's exactly what voters did. Now, all that's left is to implement the will of the voters and communicate to South Dakotans about how to enroll. Earlier this year, the South Dakota Department of Social Services, which is charged with the enrollment and administration of Medicaid, told lawmakers that it would need 68 additional employees and more than $21 million to handle the influx of new enrollees. DSS has no plan to market the expansion.
We don't have a marketing campaign per se planned independently.
Communication is particularly important because to add to the already complicated new requirements and deadlines, South Dakota is currently working to remove people from Medicaid coverage. That's because during the pandemic, the federal government prevented states from removing people from Medicaid, but starting April 1st, those rules are no longer in effect. The very same people who are currently having their coverage removed may qualify for the expanded Medicaid beginning July 1st. It's estimated that over 50,000 additional people in South Dakota will qualify for the expanded Medicaid coverage. Joining me tonight are three guests: Attorney Jim Leach, who helped draft one of the versions of Constitutional Amendment D, which expanded Medicaid; South Dakota State Representative Steve Duffy from District 32; and Mitch Richter from the South Dakota Farmers Union. Thank you so much for being with me here tonight. So Jim, let me start with you. One of the first questions that I get is, what is the difference between Medicaid and Medicare?
Sure. Medicare is for people like me who are 65 and over, in my case quite a bit over, and it's also for some disabled people, those who have been found disabled by the Social Security Administration. By contrast, Medicaid is a program which traditionally is for really poor people. And with the Medicaid expansion in South Dakota, we slightly expanded that to people who are at up to 138% of the federal poverty line, who often are referred to as the working poor. So those are the basic different eligibility criteria. The one-sentence version of how the programs are different is that they have different benefits and they work just somewhat differently.
So you were talking about now the expansion of Medicaid is going to redefine the qualifications for people who will be able to apply for Medicaid, up to 138% of the federal poverty level, which for a single person is around $20,000. For a family of four, it's around $41,000. And those people will now qualify.
That's right.
So the coverage is supposed to begin, as I understand it, on July 1st of this year. Is that when coverage begins, or is that when people can apply?
Under the law that South Dakotans put into our Constitution in the election, Coverage begins on July 1st. Specifically, the very first words of the constitutional amendment say, beginning July 1st, 2023, the state of South Dakota shall provide Medicaid benefits, etc. So there isn't any black and white here. That's the state's obligation. And if the state doesn't meet that obligation, that's the kind of thing that winds up with somebody in court saying, Judge, the state has this obligation, they haven't met it, you need to order them to meet it, pronto.
Now you mentioned that because there have been other states where the state has been taken to court in order to either fund the program or implement the program in one way. So that's an option if it doesn't happen. It might end up from the voting box to the courtroom.
Well, it will end up if the state doesn't do what it's legally required to do and what the citizens said it has to do. It will end up in court.
Now, one of the things that is confusing is on the DSS website, it says that people can start applying July 1st, but the benefits are supposed to start July 1st. If they don't start actually applying until July 1st, would the benefits be retroactive?
Well, I hope so. I'm not sure I have a definitive legal answer to that, but the state has an obligation to make these benefits available as of July 1st. And so if it doesn't carry out that obligation for whatever reason, it's not complying with the will of the people.
Okay. Representative Duffy, let me ask you about the legislature's role in all of this. What is it?
Well, obviously it went to the vote of the people and it amended the Constitution. So that takes the legislature, for the most part, out of it. Now we're obligated to fund what the people voted for. And my understanding is we have a supplemental bill that was worth about $6 million that gave money for the bed down of the initial program that has to be going by July 1. So, and then as of July 1, the new budget year, there will be a sum of like $600 million allocated to this thing. Now that's before all of the FMAP and all the funding mechanisms from the federal government. So our deal is to pay for it, or to allocate the money to it, and that's what the appropriators do. I'm sure when the governor gets her budget, she will have that in there. There's no option for her. She has to include that, whatever she sends to us to work. How the appropriators pay for it, might change a little bit, but beyond that, it's in, it's going, and that's where it's at.
So the voters approved it. DSS originally asked for an additional 68 people, funding for 68 new employees in order to implement this, and another $12 million, $12.7 million to fund just the implementation of it. We're not talking about benefit funding. And so the South Dakota legislature gave them about half. Why is that?
Well, I'm not an appropriator, but what I understood is they had enough money to hire 34 full-time equivalents, full-time employees, to get the program off the ground. And I'm told, and there again, what I have learned by reading on this is a lot of these numbers are fairly vague. So I don't want to speak. I spoke to the LRC about this, and they told me that between the federal government and state government, they'd allocated $6 million, $3 million each, to get things going, to hire the people, to get the data or the computer systems up and ready for this kind of deal. And then the second 34 people would be hired after the 1st of July.
So the legislature has done its role in funding this process.
Exactly.
Now, you co-sponsored a bill this past session that would have added a work requirement to qualify for expanded Medicaid. Tell me about that.
Well, that was a bill that Representative Venhuisen had written, and I did support that, and I do believe that is I think that is a proper way to do this. It's going to cost a lot of money, And there's nothing, in my mind, nothing wrong with asking people who receive some of the benefits to help. We have an incredible workforce shortage here, and we have a 1.9% unemployment rate. Now that doesn't include people who are not looking, but we need to move people from part-time to full-time. There's very few, I mean, if you want full-time with benefits in this town, it's not hard to get. There's other reasons, and I'm not saying there aren't other reasons, because certainly there are people that aren't capable of this, and we got to keep that in mind. But I hope, and I haven't heard for sure if the representative will bring that bill back next year. You heard Dusty Johnson is doing a similar thing on the SNAP benefits. You know, whether that comes to fruition, I have no idea. But I do believe personally that there should be a work requirement.
And this proposed bill didn't pass, but Mitch, you and I were talking about this and the effect that it might have on farmers and ranchers. Tell me about that.
Well, that bill did not pass, and really what they're asking is that would be part of the plan that the federal government would then approve. So the federal government would have to approve that work requirement. They had that in now, and it's not been approved by the Biden administration. So that's a piece of that. It's not like the state can mandate that you have a work requirement. But 64% of the people that are on Medicaid are children. So you're only talking about 36% of the people that would be eligible for that work requirement. And then there's the definition of able-bodied. Who defines what able-bodied is? If it's an able-bodied person, I can look perfectly fine and able to work, but maybe I have COPD. I can look perfectly fine, but maybe I'm going through cancer treatments and I can't work more than 2 hours a day. So there's all kinds of issues with Representative Duffy's and Representative Van Huysen's work requirement, which that's why it really didn't pass this particular year, is because those issues were brought out. But as far as the ag requirement, South Dakota Farmers Union supported this because we want to see clinics and hospitals remain open in rural South Dakota. If there's an accident on your farm or ag operation, you don't want to have to drive 200 miles to get care. And so that was one of the reasons we did it. Largely now, you have one of the spouses of an ag operation, maybe they get a job in town that provides the insurance for the family or for the couple. So we wanted to see that care is available in rural South Dakota, and that was one of the main reasons we supported this.
Okay, we're going to continue our discussion. We're going to take a quick break right now, and we will continue with this month's Focus edition of Medicaid expansion. Welcome back to this month's edition of Focus. We're talking about Medicaid expansion. Mitch, you've been involved with the Medicaid expansion process on behalf of the Farmers Union. And farmers and ranchers are in a unique situation when it comes to accessing medical insurance. Tell me about that.
Well, depending on the year, is it a dry year? They don't have a crop. Are cattle prices down? I mean, their income can fluctuate from one year to the next. So some may qualify for Medicaid, and one year and not the next, because corn prices are way up, soybeans are up, you have a good year, rain comes the right time, cattle prices are good, and so they don't need necessarily health insurance that particular year. But this is sort of a backstop for them when they are going to need it. But again, we wanted to make sure that it's available. And the legislature had 14 years to pass this. They didn't do it, so we pushed it to the vote of the people, and they passed it with 57% of the vote. So we think it's a good backstop for the rural ag economy in South Dakota.
You were also talking to me about some of the unique obstacles that you think might affect farmers and ranchers in applying for Medicaid coverage.
Well, it's incumbent upon the state to make sure that they get the word out that number one, this is available for anybody that has 138% of the poverty, their income. And then if they aren't eligible for this particular program, that there are other programs that they could apply for that may be within their price range at this point. So the state has a big job to do to get the word out. I mean, there's 140,000 people right now that are on Medicaid in South Dakota. That number is expected to grow someplace between 40 and 52 to 55,000. And the state needs to make sure that whether it's PSAs or postcards or, you know, ads in papers, whatever it is, they need to make sure that they get the word out so that everybody's aware that the program is available.
And there's no shame in applying for the program.
There isn't, and you know, that's one of the problems in South Dakota is we're proud people in South Dakota. We don't, you know, want to ask for help unless we absolutely need it. And so there are people that just won't apply because, number one, they're embarrassed by it. They're concerned that they're going to be looked up on differently. And there's no shame in applying for this. That money is available at the state level and at the federal level for you if you need it. So we urge everybody to get in and apply if they think they're eligible.
And now, Jim, this will also help the Native American population. They have access to IHS, but it's not exclusive. Tell me about that.
That's a really important point. Let's start with IHS. I think a lot of non-natives are under the impression that IHS just provides every service and great care for all Native Americans. And whatever its positives, there are a lot of negatives with the IHS also. And typically the IHS runs out of money at some point during the year in order to be able to fund the health care that people need if they need a surgery or something, and people wind up on a very long list if they're Native. So Native people, apart from the IHS, they can be eligible for Medicaid just like everyone else. I mean, of course, we don't discriminate based on skin color or heritage in providing Medicaid services. And the Medicaid benefits can be vastly better to IHS because with Medicaid benefits, you can get in the hospital for a surgery. You can get medical care as long as you can find a provider who will take Medicaid. And it completely takes a Native person, many of whom don't live on reservations at all, away from the necessity to try to get to IHS, to try to get their care, to where they can get the same care that all other folks can get.
All right, so they work hand in hand. They can be a supplemental coverage.
It's supplemental, but completely separate too. In other words, Native people don't have to go to the IHS first. They can use their Medicaid benefits first.
Okay. Well, thank you so much. We will continue our discussion about Medicaid expansion on this month's edition of Focus. I'm Alicia Garcia in for Jack Cottle talking about Medicaid expansion for this month's edition of Focus. So finally, let's talk about this coverage gap that people may be experiencing. Beginning April 1st, the COVID pandemic emergency restrictions have expired. So now states can begin removing people off of the Medicaid coverage. Now, these very same people may in fact qualify for the expanded Medicaid beginning July 1st. They estimate about 22,000 people will be removed in South Dakota, and about half of these may very well qualify beginning July 1st. So they're going to have a coverage gap from whenever they're removed until July 1st. Mitch, what are some of the options that people will have?
Yeah, because of COVID and the public health emergency declared by the federal government, nobody could be kicked off of Medicaid for, I think it was 30 months. And so now states are going back, reassessing eligibility for all of the people that are on, and they may well not qualify. So it's the state's obligation to tell them you may apply for health insurance through the Affordable Care Act, which maybe you can get insurance for $40 a month or $30 or $20 or a supplemental insurance until you're eligible again for Medicaid, or to take you off of Medicaid and maybe you have employment that is providing insurance for you and your family. So there's options, but it's really up to the state to let them know what those options are. and there's a number of them. And that is what, when Steve talked about the governor's budget, those 34 to 68 people that they're hiring, that's what they're doing. They're preparing for the influx of new people and to be able to help define eligibility to those that may not qualify anymore.
Because there is an extended open enrollment period under the Affordable Care Act where people can apply if they are kicked off of Medicaid before they are reinstated. And that begins March 31st of this year, and
Correct.
it goes through July of
Correct.
next year. But they have 60 days.
Correct. So it's important that they pay attention to where they're at in the system, and depending on what happened, maybe they got a good job in the last 12 months, and now their income, they don't qualify. But they really don't qualify. Their employer doesn't offer health insurance, so they need to go onto some other system. And there's lots of insurance companies that are offering different programs, working with the state and federal government.
So it's really important that people know about what's happening. DSS, I know, is putting on some webinars, but not everybody who is going to be affected by this has access to a computer. A lot of people don't have houses, let alone computers. So there is a website, if you can get to it, that has offering easy-to-use information. It's getcoveredsouthdakota.org. Also, there's many organizations like the American Cancer Society, LEAD, which is Leaders Engaged and Determined, AARP, South Dakota Voices for Peace. These people will be knocking on people's doors, setting up outreach programs, setting up flyers, getting all kinds of ways, translating documents for people who don't speak English, to be able to get information out there to people. One of the confusing aspects of it, as people are getting these letters and being removed from Medicaid, is whether or not that affects their children. So, Jim, how does that affect?
The real answer is I don't know. But I think the point that this whole discussion really raises is that people really need to reach out to the kinds of resources you've talked about and any other resource they can find to figure out what's going to work best for them and their family, because unfortunately it's a confusing system, and unfortunately the consequence of not keeping up with what's going on can be really terrible.
Well, I'll give you a short answer to the question that I asked. Is there are different other kinds of ways that people can get health insurance for their children. Usually, if the adult is kicked off of Medicaid, their children will still qualify under different programs. So that's one of the aspects that's kind of confusing, because you're going to be getting these letters and then not know what your options are.
It is very confusing, but the state does a great job in training the people that are going to implement this system and work with these individuals. So you just can't emphasize it enough that you need to talk to those social workers so that they can help you get to the right program so you don't have a gap in coverage.
Okay, so just to recap, July 1st, benefits should begin. People can apply on the DSS website. It's people 18 to 65 who fall under 138% of the federal poverty level. Is that about right?
That's right, and then at 65, Medicare.
Well, thank you so much for joining me tonight. I think that's going to be really helpful for people as they process through all of this kind of confusing information. But there is information out there. GetCoveredSouthDakota.com. That's going to be a website that will offer you a lot of useful information. Thank you for joining me tonight for this special edition of Focus, this month's edition on Medicaid expansion.